Hello all, welcome to Pathospash. In this video, we'll be going through the second part of cellular adaptation. In the previous video, we looked into definition of cellular adaptation, hypertrophy and hyperplasia. In this video, we'll be looking into atrophy and metaplasia. Now let's go in detail about atrophy. Now in this image, you can see that on this side, you're seeing a normal tissue, and on the other side the same tissue has undergone decrease in the size, which is mainly because of decrease in the size of the cells and decrease in the number of the cells. So this whole process where the size of the tissue has decreased because of decrease in the size of the cell or decrease in the number of the cell is called atrophy. So atrophy is defined as reduction in the size of an organ or a tissue resulting from decrease in the cell size and number. Now let's see how atrophy is caused. Atrophy is mainly caused because of three things, and they are decreased protein synthesis, increased protein degradation, and thirdly autophagy. Now, whenever a function of a cell reduces, the cell try to decrease the protein synthesis, and also it will try to increase the protein degradation to remove the unwanted protein, both of which will result in decrease in cell size. Now, whenever there is any nutritional deficiency or disuse of any organ or a tissue, there will be activation of ubiquitin proteasome pathway. Because of this activation of ubiquitin proteasome pathway, there will be formation of autophagic vacuoles. Within these vacuoles, all the cell organelles will be present. This autophagic vacuole will later combine with lysosomes to form autophagolysosomes. And within these autophagolysosomes, the enzymes that are present within the lysosomes will degrade the cell organelles and thereby causing cell death. Because of the cell death, there will be reduction in the number of the cells. Since there is both a decrease in the cell size and decrease in the number of the cell, atrophy is caused. Atrophy is basically of two types, and they are physiological atrophy and pathological atrophy. Now let's go in detail about physiological atrophy. The first example under physiological atrophy include atrophy which is seen during fetal development. This is mainly seen as atrophy of certain fetal structures like the thyroglossal duct and notochord. The second example include atrophy which is seen in adults. And first example under this include atrophy of the brain, which is mainly seen during old ages. And second example include involution of the thymus, which is seen as the age passes. Now let's go into pathological atrophy. Pathological atrophy is basically of two types, and they are local atrophy and generalized atrophy. Local atrophy is of four types, and they are disuse atrophy, which is mainly caused because of decreased workload, denervation atrophy, which is mainly caused because of decreased nerve innervation, ischemic atrophy, which is mainly caused because of decreased blood supply, and fourth one include pressure atrophy. Now, generalized atrophy mainly includes starvation atrophy, which is mainly caused because of decreased nutrition. Now, let's go in detail about metaplasia. In this image, you can see on the left hand side is a normal tissue which is made up of columnar epithelium. On the right hand side, you can see that some of the columnar epithelium is replaced by squamous epithelium. So this process of change of one epithelium to another epithelium is known as metaplasia. So metaplasia is a reversible change in which one adult cell is replaced by another adult cell type. So metaplasia is mainly seen during tissue damage, tissue repair, and during regeneration. Now let's see how metaplasia is caused. Whenever a cell experiences any stress or stimuli like the tissue damage or tissue repair or regeneration, there will be increased production of growth factors and cytokines, because of which there will be increased proliferation of pluripotent mesenchymal stem cells. And because of the continuous stress that the cell is undergoing, they will be reprogramming within the stem cells, because of which there will be metaplasia. And if the stress that the cell is undergoing persists, then the cell which has undergone metaplasia can get converted into dysplasia, thereby resulting in cancer. So metaplasia is basically of two types, and they are epithelial metaplasia and connective tissue metaplasia. Epithelial metaplasia is of two types, and they are squamous metaplasia and columnar metaplasia. Connective tissue metaplasia mainly includes osseous metaplasia. Now let's see some of the example for squamous metaplasia. The first example under this is metaplasia occurring in the cervix. The normal epithelium seen in cervix is columnar epithelium. And this columnar epithelium after metaplasia gets converted into stratified squamous epithelium. Since the final epithelium that is formed is squamous, we call it as squamous metaplasia. The second example include metaplasia which is seen in the respiratory tract. The normal epithelium seen in respiratory tract is pseudostratified columnar epithelium. And this epithelium, because of chronic smoking or any other disease, gets converted into stratified squamous epithelium. Here also, since the final epithelium formed is squamous epithelium, we call it as squamous metaplasia. Now let's see some of the examples for columnar metaplasia. And the first example under this is Barrett's esophagus. So the normal epithelium that is seen in esophagus is stratified squamous epithelium. And in Barrett's esophagus, this stratified squamous epithelium is converted into columnar epithelium. Since the original epithelium is converted into columnar epithelium, we call it as columnar metaplasia. The second example include intestinal metaplasia, which is most commonly seen in gastric epithelium. So this is an image which shows the normal gastric epithelium. And in intestinal metaplasia, this normal gastric epithelium is converted into columnar epithelium, and since the final epithelium that is formed resembles the small intestine, we call it as intestinal metaplasia. Now next, let's go through osseous metaplasia. Osseous metaplasia is the formation of new bone at the site of tissue injury. And most common example for this is myositis ossificans, which is formation of a new bone within a muscle secondary to intramuscular hemorrhage. So in this image you can see that a bone formation is occurred within the muscle, and this is secondary to intramuscular hemorrhage. So this is osseous metaplasia. So this completes the chapter cellular adaptation. Do subscribe to my channel and click on the bell icon, and do share the video with your friends and colleagues. Thanks for watching.